Hi, I'm Mike Conaway, and I want to give you a quick update on where we stand on Wednesday, January the 13th, with respect to the health care bill. The conventional wisdom that it's a done deal, that something's going to happen, is not right. This deal is still in the breach. You've got leadership in the House, Charlie Rangel and others, saying that the Democrats are in deep division over many of the proposals and trying to reconcile the difference between the House and the Senate. One of which, of course, is the pay for. The Senate version calls for a big tax on Cadillac health insurance plans, which the unions are opposing. The House version calls for a tax increase on high-income earners above a certain amount of money, as well as an increase in Medicare taxes for many others who are in a different bracket. So those two things have to get reconciled, and there's strong opinions being held on both sides. In fact, the Democrat moderate is leading the charge in the House to try to stop the tax on the union workers for their Cadillac plans. That is good news for those of us who want this thing to die a rapid death so that we can, in fact, start over and deal with health care reform in ways that most of you would agree with. Probably the single issue that stands the best chance of bringing it to a halt, and that is federal funding of abortions. This isn't about abortions per se. This is about whether or not it's correct to take taxpayer money from all of us and fund a procedure that many of us are against. And Bart Stupak led the charge on the House version to get really strong language in the bill, in the House version, to protect and make sure that didn't happen. The Senate version is not anywhere near as strong. And so trying to reconcile that, because there's some strongly held opinions in the Senate that the federal government should, in fact, fund abortions, and equally strong positions in the House for many of those members. I personally am working with moderate Democrats to try to convince them to either stick with their no vote, that they voted no in November, and or convince some of those who voted yes in November that this Senate version is not the right way to go, and that if they'll vote no, kill this thing and scrap it, start over, as most the folks in District 11 have communicated to me is what they would like to see done, then we can make that happen, and out of the ashes, the phoenix out of those ashes would be a health care reform that would be targeted toward pre-existing conditions, be targeted toward tort reform, be targeted towards buying insurance across state lines and associated health plans, other things that we could do on discrete individual bills that we could all read, could all understand, and make sense of, and trust the process. Much of what I've heard in District 11 over the last 5 months is that the people back home do not trust the process. A 2,500-page bill, a 2,000-page bill in the House, just way too big, too cumbersome, too fraught with potential special deals, as you've seen out of Nebraska, and the people back home have lost trust in the system. If we put together some relatively discrete bills that most folks could read and get their arms around, it would do two things. One, it would address an issue that we all want addressed, i.e. pre-existing conditions, but it would also begin to rebuild institutional trust in the American people in the legislative process, which is going to be important as we move forward in some of these tough areas. So your work, grassroots work at calling your members of Congress, your senators, calling their, particularly the senators, the offices in their states, is particularly important, because the switchboards in D.C. Are clogged up and are shut down on many days just because of the volume. So your communication with your member of Congress or your friends who live in other congressional districts and or other states, their communication to their senator and their member of Congress is important to kill this deal. So it's in the breach, as I've said. Stay in this fight. Continue to make those calls. Continue to do what you can at your part to convince members of Congress that are on the fence as to which way they want to go to vote no, kill this deal, and let's start over. Appreciate you being with me today. Thanks.